Hi, everyone, and welcome to our Self-Direction Conference Showcase, Best Practices for Engaging Self-Directed Caregivers with Training. My name is Casey DeLuca, and I'm the Director of Membership and Conferences for Applied Self-Direction. I'm going to run through just a few quick housekeeping issues before we begin. You can submit your questions and comments at any time during the showcase by using the Q&A pod in the lower left-hand corner of the Adobe Room. If you experience any audio or technical issues during today's presentation, you can send us a message either using that Q&A pod or emailing us at info@appliedselfdirection.com. So with that being said, I will turn things over to Jonathan from Trualta to get us started.
All right. Hi, everybody, and welcome. Thank you for joining us today to discuss best practices for engaging self-directed caregivers with training. We'd like to thank Casey and all our friends at Applied Self-Direction for hosting this wonderful virtual event. We've tuned into a number of the sessions and really just love the format and the content over the past few weeks. We are excited that this topic resonated with so many of you. We know it's a major need. We've been training family caregivers across the U.S. and Canada in partnership with local government, area agencies on aging, healthcare insurers, and providers. And recently, we've seen a huge increase in self-directed programs that are looking to train caregivers, both their family caregivers and their registry workers. We really love that the spirit of self-direction is all about consumer choice and freedom, and that's how we've always thought about our caregiver training. We provide on-demand personalized learning journeys for each caregiver, depending on their unique needs and their care situation without really rigid requirements or compliance. We think it aligns really well with the spirit of self-direction. So we're excited to share more about the program. Please feel free to drop any questions into the box there, and we'll do our best to answer them at the end. So let's start with a couple quick introductions. My name is Jonathan Davis, and I'm the founder of Trualta. A few years ago, I was working with training companies that focused on professionals, so nurses and doctors, and realized that there were great methodologies and content out there to support care at home that often were really not available to the families and the frontliners who needed it most. So Trualta really adapted professional level training to the untrained family caregiver and built a learning platform specifically for this informal audience. I'll pass it over to Steph to introduce herself.
Hello, I'm Steph Carbonio, and I'm I'm a product designer at Trualta. My role involves meeting with our users, talking about their everyday routines, their particular care scenarios, and then we turn those user needs and wants into features on our platform, and I'll be sharing some of these examples later on.
Great, thank you, Steph. Okay, so for discussion today, in our time together, we're going to discuss these three things that you see on the screen today. The current state of training caregivers. So we've talked to a number of self-directed programs about training, and we want to share with you what we've heard. Number two is best practices for engaging caregivers. And lastly, we're going to share how we partner with state MCOs and other self-directed programs. Okay. So here is what we've heard about training from numerous organizations over the past few months. And note, throughout this presentation, we'll sort of use caregiver and provider interchangeably. So generally, what we're hearing talking to self-directed programs across the U.S. and Canada is that the content of training is typically payroll, hiring, time tracking, the compliance things. But limited content is actually provided on care skills, so helping your caregivers provide better care. Most of the delivery of training right now, it's in-person sessions. Many of those were obviously canceled during the pandemic, and often program administrators tell us that they have difficulty with attendance, despite often inviting really great speakers from local colleges or nonprofits to present. And we also know that training for caregivers in the self-directed context typically is not linked to outcomes, at least in the current state. but we are really inspired by some of the innovative programs that we're starting to see, and they're really recognizing the value of caregiver training. So specifically offering skills to help caregivers manage stress and burnout, also skills to improve the care that they deliver at home. So a few examples might be personal care and activities of daily living, managing brain health and cognitive decline, or safety and fall prevention at home. And we've seen a lot more online offerings for training, especially post-pandemic. So innovative organizations are recognizing that web-based, on-demand content is far more flexible for a busy caregiver than in-person events. And lastly, and really maybe most importantly, these innovative partners are interested in data. They want caregiver engagement. They want self-directed, self-reported outcomes. And they're really interested in building the business case for their leadership teams to invest behind supporting caregivers with skills. So, speaking of training outcomes, our innovative partners think about outcomes in 3 categories. And I really encourage everyone on the presentation here to think about how these outcomes align with the strategic priorities that you as an organization offering self-direction think about every day. The first kind of group are caregiver outcomes. So helping caregivers focus on self-care, helping them avoid burnout and build confidence. We tackle really tough topics like caregiver guilt and mental health because we know that caregiver burnout leads to caregiver turnover and ultimately higher cost of care. The second kind of bucket of outcomes that we look at when we train caregivers are actually consumer outcomes. So when caregivers understand proper techniques for moving and transferring, for example, or have tips for managing communication challenges during cognitive decline, they're able ultimately to provide better care and better outcomes, often extending time at home. And lastly, we talk to a lot of organizations about outcomes for their program. So our partners are interested in supporting their providers and caregivers to help build skills and ultimately develop professionally as caregivers and care providers. So before launching into more about these trends and best practices that we're hearing out there, I want to take a quick step back to share more about what Trualta is. Simply put, we're a web-based training platform for family caregivers and self-directed workers. We provide on-demand, personalized education for caregivers, and it's not based on compliance. It's specific to their care situation. So if you're caring for a stroke survivor with limited mobility and diabetes, we can deliver you a very tailored experience. Our content is bite-sized, ranging from 5 minutes to 3 hours, and delivered in varied formats, so e-learning, audio, video, print. And our library is professional level training, but it's adapted for an untrained audience, and it's wrapped with social features that promote community and help your caregivers feel less alone. And lastly, we're all about proving outcomes for caregivers and care recipients. We want our healthcare and social service stakeholders like you to really understand the value of a trained and confident caregiver. So we partner with social service organizations, healthcare providers, insurers in 21 states. Each of our partner agencies or organizations have a dedicated branded learning portal for their caregivers. Our portals are always loaded with our skill-based training, but each organization can add local resources. So our portal in Ohio might look different than in Wisconsin or Minnesota because in addition to the skills that we offer, it also includes local resources. All right, enough about us. Let's get back to some of these best practices. And during our time together today, I really want you to come away with a few best practices for implementing caregiver training in your organization. We will share quick examples for each that we hope really inspire you to find new and innovative ways to support your caregivers with training. So our best practices. Number 1, really understand caregiver motivators. If you're not required to train or achieve a certification, why participate in training at all? We've learned a lot about what drives our users, and we want to share that with you today. Secondly, why we think it's important to personalize to the care situation. As you know, every care situation is unique, and their training plan and skills should really reflect that. Third, we say come for the training, stay for the community. So we've learned that how we can really help caregivers feel less alone. And four, how you can leverage data to make the business case, how you can really start to link caregiver training to improved outcomes and reduce costs for your organization. So I'll hand it over to Steph to launch in. Steph, I think you're muted.
Of course. So we'll start with this. Training is not required, so what are the motivators to engage? During our users, I've heard many reasons why they don't feel like taking on additional courses or training for improving their caregiving skills. It usually comes back to them being understandably tired, overwhelmed, frustrated. But after giving Trualta a try, our users were actually very satisfied with our platform because it gave them practical solutions to real everyday challenges. So it was a great use of their time that in turn gave them more time for themselves. So let's look at these motivators in more detail. So number one, validating current techniques. This is something that I hear all the time. How do I know that this is the right way to do something, or is there an easy way to do this? One example that I can think of is a woman caring for her mom, and her mom wasn't eating much, and she just thought she wasn't hungry and she didn't want to push it. But after joining our platform and reading our content, she learned techniques that when applied got her mom eating again, and it turned out that her mom basically wasn't even able to look at the food, see the food. So techniques like rotating the plate, improving the lighting in the room, using a white plate to create contrast, those were tools that helped her. And this is one example of how our tools show our users that they're doing the best they can, that this is the best approach. Number two, becoming part of a community. Caregivers feel lonely, that's a fact. More than one user told us that they've lost friendships, even family ties over being a caregiver because it's so time consuming. Some crave interaction with others and healthcare professionals, and some of them just want to feel safe, sharing their frustrations, venting. So when they join Trualta, they find that there are more people like them going through the exact same thing, and it gives them a sense of belonging and peace. And aside from meeting other people that can generally empathize with them, they've also mentioned that they've been able to learn from other caregivers' experiences. So they find that by talking to other users, they discover new ways of caregiving. And they share tips like local resources or how to make X caregiving task easier. Number three, and it's building on this last one, is users actually learn a lot from other people's experiences. And like I said, it could be either ways to manage a behavior or a caring task or even ways to cope. One thing that constantly comes up is the caregivers struggle to respond rather than react to their recipients, so care recipients. So there's different information on different websites on our platform, but then when caregivers come together and share their own approaches, approaches that might not be conventional and they're very creative, it helps. So in this particular comment that we hear a lot is, one particular comment that comes to mind is one caregiver who her care recipient, she realized that her care recipient didn't need more medication. In fact, she needed to learn how to communicate better with him. And so by sourcing different techniques, that situation improved. She learned new tactics of communication, and her husband didn't need more meds. And number four is a desire to help. So I guess this is number one motivator, and because it encompasses everything we talked about. Caregivers are willing to go the extra mile to care for their care recipient in the most dignified, loving, and safe care there is. However, the phrase, "I don't know what I don't know," often comes up. They're willing to do their best, but they don't know where to start or what that means. So our platform displays the content in such a way that our users can be sure that they're learning everything they need to know to become the caregivers they want to be. Which brings me to my next point, which is training resources should be personalized to each care situation. So how do we at Trualta as a platform use personalization to adapt to each care scenario? With our interviews, we learned that every care scenario is different, and no matter how similar the user journeys might be, they come to Trualta with different individual needs and challenges. And we realized pretty quickly that some of our content might not be applicable for everyone. So I want to show you some ways in which we show the users the information that's most relevant to them. This is the first screen of our onboarding process, and I'm going to walk you through them quickly. So this is the first question where we're asking if they want a recommendation or if they want to explore on their own. And then we ask questions like, what brings you to Trualta? Where are the goals that you have, and what's your experience as a caregiver? And then we're able to give them a recommendation based on those questions. And so our platform with those answers can quickly identify which type of content in our library would be the most suitable for each caregiver. So for example, a person caring for someone who just got diagnosed with stage 2 Alzheimer's might not be interested in learning about palliative care. So many users have expressed the fear of the future, and they want to know what's coming next, but not so far in the future. They're very hesitant to read about content that describes late-stage progression. So this is a way that we found to kind of hide that content until they're ready. And this is one example of how we use our findings in our interviews to inform our platform's development and design. A second example of how we personalize our platform is a recommended for you section. So after you completed the onboarding, you get to the homepage and you will see this section, which is populated based on those answers that you've provided as a user and also the program coordinator's recommendation. Some of our users expressed that they were feeling overwhelmed by the large amount of content in our library, and it made it difficult to find a place to start. So this section aims to reduce that cognitive load and make their experience on our platform more focused and pleasant. And lastly, also in our homepage, it's our local resources section, which populates based on the user's location. And this is where they could access information about nutrition, legal, meals, and this particular section was created with two users in mind, program coordinators and users. So on the one hand, we've talked to program coordinators, and they have expressed that one of the bigger tasks is finding resources that could help their clients. And while this is a big job on its own, sharing this information is another big task. So this tool aims to give that program coordinator a place where they can download their findings and for our users to have access to this information all in one place. Users have mentioned that it's hard to find the right information because oftentimes it's scattered throughout many different sites, and it becomes a very time-consuming and exhausting task, and we know they have enough to do already. So we want Trualta to be that one stop for information like this, and this tool is one step towards that goal. Come for the training, stay for the community. So our users really enjoy our platform for its innovating, relevant information, but community is also a big part of it. When we ask our users about how they benefited from being part of Trualta's community, they say things like, it's nice to speak honestly with a group of people that's not judgmental, I want to share my experience with others, or the more you talk to other people, the more you learn. So the community aspect of the learning experience is super important, and it creates it creates a space for users so that they can come together, make friends, and feel like they belong, and it also gives them a reason to come back to our platform. One example in which we facilitate community engagement is our What Would You Do module. And so in this module, we post a question related to everyday caregiving tasks. And we ask our users to share their own experiences or tips or approaches so that others that are reading can learn from it. So in this example, we asked them, it is a struggle to get my care recipient to take a shower. What can I do? And just as a side note, these questions are often things that our users say during interviews that they find the most challenging or they struggle the most in their daily routine. So these questions are from caregivers to caregivers, and we're just facilitating this interaction. We have numerous responses on this specific module, but these are some of the highlights. Just some simple tips like turning on the heater in the bathroom or having a handheld sprayer. Little things that will make the experience of another caregiver going through this a lot easier. And I'll hand it back to Jonathan for now, who's going to walk us through some data. Thank you.
Excellent. Thank you, Steph. So last best practice we're going to review today is leveraging data to build the business case for implementing a training program. So we think this is absolutely essential. I mean, for us, a confident trained caregiver isn't a nice to have for a self-directed organization. It's a need to have, and it really can improve outcomes and reduce costs. So we work closely with all of our partners to build the business case for caregiver training. So in this example, we asked caregivers about the training that they'd received in the past and their level of confidence providing care for their care recipient. 95% of caregivers that had received training felt confident versus only 54% of caregivers that were not trained reporting that they felt confident. And for many of our partners, a confident caregiver is the difference between remaining at home and transitioning to long-term care. And the savings are enormous. So this is an example we prepared for a partner in California, comparing costs of care for the self-directed population age 65 plus. Staying at home for just 3 months longer can save nearly $25,000. And sometimes that delay can be due to whether the caregiver is confident providing care at home. All right. Let's recap quick. We went over 4 best practices today. Understanding caregiver motivators, what drives users when it's not a compliance-based learning environment. Number 2, how we personalize to the care situation and why that's so important. Number 3, come for the training, stay for the community, how we can make caregivers feel less alone. And lastly, leveraging data to make the business case. So in the last few minutes here, we're very quickly going to share, knowing these best practices, how we form really unique partnerships with self-directed organizations to train caregivers. So first of all, we set up sort of a dedicated co-branded portal for each partner. So this includes local resources that are tailored to the individual. And if you have past training events at your organization, with a local college or handbooks or other resources, you can actually include that in the training library. So it is your portal. And in this screenshot here is a Minnesota portal. They even have local content that has to do with just their tribal and indigenous caregivers. So it can be highly localized while still having a full library of skill-based training. We also really speak to individual caregivers. So for example, on this page, this screenshot here, it says, how do I provide the best care? And you're tired of general information. These words really matter, and they can be the difference between whether or not the caregiver engages with the training. We've tested these call to actions extensively with thousands of caregivers to really figure out what resonates most with them. Again, without often a requirement to participate, we really need to focus on speaking to those caregiver motivators. We also hate hearing that training attendance was low, but we know how hard it is for you and your organizations to reach thousands of caregivers or providers. One of our self-directed organizations recently told us that they're using robocalls to let people know about training. Our team provides all of the turnkey marketing material, social media posts and printed flyers and example modules. We know that our self-directed program administrators often don't have the resources to launch a full marketing effort, so we do it for you. We really think that the program can only be successful if we market and promote it to your caregivers and providers. And then lastly, we use real-time data and analytics to understand who's using the training and what material is most relevant. This data informs how we develop new content and how you can engage your existing users. You get unique insights into your demographics, your content needs, as well as any results from self-reported assessments or surveys. So you could administer a burden questionnaire or a similar assessment for your caregivers, and all that information is available in real-time data feeds for you. All right, we're going to finish off with a quick story. We're really excited this month. We got a study published in the Journal for Alzheimer's and Disease Reports. We ran this during this project during the pandemic. 60 caregivers over 30 days in isolation across the state of Florida. Average participation in 33 activities, totaling 8 hours. So those activities could be e-learning modules and quizzes and music therapy, videos, audio podcasts, really great engagement in just 30 days. And then we asked the caregivers in this study, did you use the skills that you learned in the portal? And if you think back to how Steph talked about personalization, for us, it's all about delivering the right training to the right caregiver at the right time. And if we know that 92% of them are using the skills, that we're getting really good at delivering the right content to the right caregiver. And then we looked at outcomes for both the care recipient and the caregiver. And just in 30 days, we saw a decrease in the severity of behavioral symptoms and the distress associated with those behavioral symptoms. So we found when we talked to caregivers in this study that just knowing more about brain health, understanding the progression, really hearing from other caregivers about what they were going through and their perspective, they perceived their care situations to be both less severe and less distressing in just 30 days. So outcomes we were really excited about. And then lastly, we saw a major improvement in caregiver fulfillment. So we found that our caregivers, when they knew they were doing all that they could, getting as much training as possible, they were a lot more fulfilled and satisfied with their role as a caregiver. Well, that was a ton of information. We hope that was helpful. We hope we inspired some innovative ideas for how you can engage your caregivers. Thank you very much for your time. Steph, thank you so much for presenting with me and bringing your design expertise here. And we're going to go to some questions, but we do also really need your help with a quick 3-minute survey. Casey will drop it into the chat box there, and if you can tell us a bit more about your organizations and what you look for in training, it'd be super helpful as we develop our program. So thank you so much, and we look forward to some questions.
Great. Thank you so much, Jonathan and Steph. We have gotten a few questions, so I'm just going to jump right in. The first one, let me bring it over. How often after completing any mandatory content do you see caregivers going back in and reviewing items for a second or third time? Looking to see if you know much about utilization after a box has been checked, if you will.
Yeah, that's a great question. We built the whole thing, as we kind of mentioned, it's not a compliance-based environment, so box checking is not usually, as important to us. What we try to do is target caregivers with other content that they'd like. So they watch a couple modules around, around caring for a loved one who survived a stroke or caring for a care recipient who survived a stroke, and then we continue to nudge them with similar content and put them on a learning journey to what we think they might like next. It's not necessarily going back to review the same items, but now that we know about them, we know what they're interested in, we can push them similar or other content that is kind of in line with their care situation. I hope that answers that question.
Great, thank you. Next question, who are your clients? FMS organizations, individual families, state offices for aging and disability services?
Yeah, really good question. So we don't work directly, we're very open to working with FMS. Right now, I think mostly state offices on aging, some MCO Med Advantage, so payer space, as well as providers who are offering Trualta at point of care. But we don't generally work with individual families, so usually the organization, whether it's the in-home service and support, like in California, public authority, or it's contracted at an agency level, so the individual caregiver doesn't pay, they're offered it through their program.
Great. Now I see we're at time, so real quick, I'm going to run. I know Trualta offered a raffle, so one of the attendees here is going to win a $100 Amazon gift card. So let's do that, and then I do have two more questions. If Jonathan and Steph, if you want to answer those, I'm fine going a little over. Okay, so
Sure.
Elisa Dooley, you have won a $100 Amazon gift card. So we'll follow up with you by email afterwards, but congratulations. Okay.
Congratulations, Alicia.
Next question. Oops, sorry. That was the same one we just did. There we go. Often caregivers come from different language backgrounds. What is a good way to build connections and knowledge across these different language users?
That's a great question. Yeah, so in our portal, we do, the bulk of the modules are in English. We're expanding our languages all the time. Our individual agencies have content management. So if they want to, if you're in an area with a large Russian community, for example, you can post content in any language that you'd like to drum up conversation, for that kind of language users. I don't know, beyond that, building connections between different languages, do our best to do visual, do our best to use our design so that caregivers can still sort of engage in the same content. But yeah, different language users is often a challenge. I would say what we work on is really tight health literacy guidelines so that we're writing to a grade 5 reading level to maximize sort of how accessible our content is across the board.
Great. Okay, I'm going to try to squeeze in two more questions.
Sure.
Do you have guidance on moderating the community section to ensure no false information is provided, especially health or safety related, hateful speech, bullying, etc.? Or is that typically managed by who you are contracting with?
Great question. So that is managed by the organization we contract with. We have a ton of moderation tools. So one example is the admin on the portal, or admins, will get an email every day with any comment that's been added, just a daily digest of comments. So you can go in there and remove them. We did used to worry about this, bullying and bad language. It's actually never been an issue across our portals. In 21 states, we've never had an issue with moderation, but we do include the tools so that you can moderate your portal.
Great, that's great to hear. Okay, last question. People with IDDD choosing self-directed services, including support broker service, aren't just care recipients. They are living a whole life, some with 24/7 support. Do your modules include these whole life concepts?
Another wonderful question. Yeah, certainly they do. Certainly they do. Like with IDD, we have sort of separate learning journey and learning track that does include modules for these whole life concepts, definitely.
Great. Well, thank you both, Jonathan and Steph, for going over a few minutes to answer these questions, and thank you to everybody on the phone that joined the showcase. I will be following up afterwards with a copy of the slides and the recording, and then when we close out this webinar today, your screen is going to be redirected to that survey that Jonathan mentioned earlier. So thank you all very much.
Thank you.
Thank you, Casey. Thank you all for joining today.